Hey there, Benchmarks members. Welcome to an update this week. I'm sorry I'm not with you on a live Zoom call, but I'm taking the day to be with my family at the beach. So hopefully I'm sitting on the beach when you're watching this. So first off, I want to note that there's concern in the state that the number of COVID cases are increasing. Not only are we seeing the number of cases increase, we're also seeing the hospitalizations increase and the percentage positive has gone up. On a positive note, the death rate continues to go down. So out of all of this, that's the one positive that continues. But because we have opened up even further to a new phase of the governor's opening of the state, there's real concerns about what these numbers look like. And it's particularly concerning because it's coming on right at the time that the flu season's getting ready to start. So part of the concern is the correlation of flu with COVID cases and what that means as far as taking up hospital beds and number of individuals who are getting sick or who are more vulnerable because of the flu. Also wanted to note that I had mentioned the last couple of weeks about the possibility, maybe, of some federal relief funding coming down. That has been a roller coaster to say the least. There was a point where it was no, House and Senate's going to go home. Then it was House is coming back. They're not leaving until they get something. They apparently were doing something with the White House, trying to get a deal worked out. Then President Trump said, no, we're not doing a deal. And then President Trump said, yes, we are doing a deal. And then Pelosi in the House was like, no, we don't like that deal. So this has just been going back and forth. It has been absolutely manic watching this roll out. But at this point, we are still not expecting any relief, federal relief money coming down before the election, although it is clear the White House is trying very hard to get something out sooner than later. Also, this week we had a really interesting legislative week. The Health and Human Services Oversight Committee met and they subpoenaed the DSS director for Asheville, Buncombe County, which is Stony Blevins. And Stony had agreed to come. And for those of you who watched an update from a few weeks ago, you know that we talked about the committee where they were discussing whether or not to subpoena him, and they agreed to do that. Stony had let them know that he did not need to be subpoenaed. He was happy to come freely and would be honored to present. But there seemed to be some impression that if they subpoenaed him, then he would be required to answer some questions, which currently he had been, up to that point, had been saying he could not answer because it violated the law and what he could and could not release. So this week on Tuesday, they had the HHS Oversight Committee and they brought in Director Blevins and his attorney. And the meeting started out, it was already strange, but it started out even stranger. They said, yeah, we had talked about subpoenaing the Stony Blevins, but then we decided we didn't need to, and so he's here not under subpoena. And then his attorney's like, we're under the impression we are here under subpoena. And then we get told by the Oversight Committee, oh yeah, actually he is here under subpoena. It just started out pretty wild. Basically, there was a bunch of questions about specifics of what was happening, and Stony kept telling him he could not share that without there being a court order. They kept pressing him on things he could talk about. He was really reluctant to talk about anything at all, whether it was personnel or it was related to the case. He just pretty much said, no, can't do it, and talked about that the intent that some of the previous bills had as far as their reaction to this specific case by the legislature would require releasing all the data in a file. He talked about how problematic that would be. He talked about, this is one case out of 3,000 that they get every year, and that this is that not every case will be done correctly. They won't all be perfect, but that there is a process to try to improve this, and talked about that. All this ended up with, the more he talked, the more questions they asked that he would not answer, the more annoyed it seemed that legislators became. And so by the end, they said, well, we didn't learn anything. This is pretty much how we thought it would go, which I don't know why you subpoena them if you think it's not going to produce any results anyway, and you get what you think you got. I don't know why you're not happy about it. But anyway, they were not happy. And so while they are not in session to do anything yet, what they basically said is threw a shot over the bow that coming back next session, they have intent, if they are still there after the elections, they have intent to do legislation to try to address this. The concern about this is the chilling impact this has on child welfare. And what I mean by that is we are, as a state, trying to really be in a place around permanency and getting children to permanency and trying to keep children with their families. And when you think about a director who gets subpoenaed to go before a legislative committee, and he was sworn in, which is very, very odd in these committees. He was legally sworn in to tell the whole truth and nothing but the truth. And to think about how other DSS directors feel watching this take place, you have to just assume that it creates a chilling effect around the emphasis that will continue to grow on safety versus permanency. And what I mean by that is, if there's any question that there's some safety factor at all, the concern is that the reaction will be, we got to take these kids out, because the last thing I want is to be trotted up on Jones Street and be put in front of a committee to be drilled on what I could, should, and woulda. And the pendulum has swung quite a bit onto safety side, not completely, but it has definitely moved more in that direction. What will happen as a result of this remains to be seen, but I've had a conversation with a lot of DSS directors, and this has really, really caused them a lot of anxiety and concern. So it would be hard to imagine this won't impact further on. We had sent out some information previously about an uninsured payment portal, and I just want to re-emphasize this, making sure people are aware of it. This is a program to reimburse the primary care providers with some federal funds, and it's out for COVID-related health care. The go live date is going to be later this month, later in October, and it is retroactive to September 1, 2020. There is an opportunity to get $150 per encounter, and they have $7.8 million available in North Carolina for this uninsured payment portal. So if your physician provided some COVID-related, and that's kind of broad, COVID-related health care that they did not get reimbursed for, and this is an opportunity to do that, or if you're working with some clients who are needing to access or have access care, this can be something that can be helpful for them. So we wanted to make sure that you're aware of that. Also, we've sent this out previously, but I just want to reiterate, because there's a lot of confusion about this. There is another set of provider relief funds that have came out starting October 5th. This is $20 billion that's being sent out to states. This is allowing for providers who have received previous relief funds. You can apply and get these funds again, another set of funds. And it's for behavioral health providers as well. It includes those that received previous funds. It runs from October 5th to November 6th. They are highly recommending you apply early, because 20 billion is a big number, but the sooner the better. So we have a link on the update that will allow you to get more information concerning this new set of relief funds. Again, it started October 5th. It will run through November 6th. So make sure you check that out. And if you are eligible, please apply for these dollars. Also wanted to let you know that we had announced, I believe it was last week, that the electronic verification contract, the EVV, that contract had been awarded, and we had received a number of concerns from providers about the ability to interface with the EVV. I wanted you to know that we've passed that information up to the department, the concerns that have been put forward. We're waiting to hear back, but that's definitely something that is on our radar. If you have more information specifically that you want to share with us about your concerns about the EVV, I'd really like to see that. If you would please pass that on to us. I also want to let you know that I'm having conversations with Alamy MCO CEOs about the direct support professionals and the need to find some relief, continuing to find relief for our DSPs and helping our providers be able to recruit and retain, which includes increasing the rates to be able to pay them a better wage. We have some Alamy MCOs that are in the process of trying to figure out some simple short-term solutions to that, and my hope is that will be coming out pretty soon. So that's it for this week. I hope everyone has a great weekend, and we will see you next week. As always, if you have questions, please don't hesitate to contact our office. Thanks so much.